Good day and welcome to another edition of One-on-One with Swope Health. I'm your host, Eric Wesson. Swope Health has 16 locations throughout the Kansas City metropolitan area to help you with your health needs. Give them an opportunity, whether it's dental, whether it's eyeglass wear, whatever your health needs are, give Swope the opportunity to help. And their prices are affordable. So stop by Swope Health or look them up. Google them, email them, whatever you have to do, they'll help you. My guest today is no stranger to Kansas City. Hometown girl, went to school here, went to college, came back, and has hit Kansas City by storm. And my guest today is Miss Qiana Thomason, and she is the president and executive director of Health Forward. Qiana, thanks so much for joining us.
Thank you, Eric. Always good to be with you.
So many of the things that we know about you are through Swope and through other jobs that you've had. What are some of the points that kind of molded you or made you the person that you are today?
Well, certainly my family. We are, as you mentioned, Kansas City girl. Grandfather was a pastor. My grandmother was a teacher, a dramatist, and an activist in her own right. My mother was an executive director in youth development. And so my family being very engaged in the community certainly shaped me and really planted a seed for community investment that, of course, I'm trying to bring to bear as best I can today and have been for many different roles. Attending an HBCU, Florida A&M University, or FAMU, was incredibly impactful in my career. I think not only did it solidify Black excellence being the norm and not the exception, but it really helped endear me to making sure that our children and our youth in this community and every community know that HBCUs are a strong, viable option. And really also solidified my interest in just community activism and work and advocacy. So a lot of different ways that I've been shaped by the Kansas City community and beyond.
So when you look at health concerns, what troubles you the most in the Black community?
Well, of course, the health disparities. I say health injustices because it's a more fitting term to me. In that disparities make things sound so non-humanistic. And injustices really speak to what's happening in terms of how our policies, our community decisions at the ballot box shape our health outcomes. And so health is certainly about what we eat and how physically active we are, but it's also about our community conditions. And so when I think about the things that are outside of people's direct control, that's what concerns me the most. Are there quality jobs in your neighborhood? Are there quality schools that your children can learn from? Or do you have to leave your community to go to another district that's miles and miles away just to get them a good education? Do you have access to the internet and to broadband, as of course that's access to life? And so these are the types of things that shape our health almost more than the foods that we eat, largely because of their socioeconomic in nature. And so when we think about health, it's important to think more broadly and not just about health behaviors and food, which are important, but our conditions, our social conditions as well.
And so when you say social conditions, employment opportunities, housing, and voting.
Absolutely. People who are more civically engaged oftentimes have better health. They're shaping the decisions that are made in their community that impact how many quality grocery stores they have. That's impacting access to safe, affordable, quality housing, transportation. All of those elements are social conditions that are important in our health.
You know, I tell people that voting has consequences either one way or the other. And our lack of getting motivated and voter turnout and understanding how important our vote is, you just kind of touched on it. And, you know, I often tell people this, people were upset with Senator McCaskill, so they said, well, we're going to teach her a lesson. We're not going to show out and vote. So now you got Josh Hawley, and he hasn't been that responsive. So when we talk about consequences, those are the consequences of not voting and what we're seeing. So what are the legislations that you are particularly concerned with? I think the voting rights bill and not passing that bill, but most importantly, recently Missouri passed a new voting law. What are your thoughts?
Well, there's a lot to that voting law. Let me start with what's most important to us at Health Forward. Our number one policy priority that's affecting all Missourians, and particularly Kansas City's community, is Medicaid expansion. So to your point, for many years, Kansas Cityans were waiting on the state legislature to act to pass that, and passage really meant that more people had access to health care services, health and behavioral health services. Health Forward led the initiative to take that vote to the people. It was a ballot initiative. And through the people's vote, got that passed. And so now we're trying to ensure that everyone knows that they who are eligible for Medicaid expansion, that they get signed up. Swope Health is one of the organizations who people can engage to learn more about Medicaid expansion and if they're eligible, and to get signed up. So I want to make sure that I share that just in terms of access to direct health care. But there are a lot of public health issues of concern in terms of our public health authorities having policies and power stripped from them to keep the community healthy. That's an area of concern. How our public health departments are being adequately funded so that when things come, like COVID, like syphilis outbreaks that we're dealing with right now in the Kansas City community, that our public health department has enough resources to be able to manage effectively the health and well-being of our population. And so I want to make sure that as we think about some of these broader issues, that we also know what's happening right here that's affecting our direct health in Kansas City.
Really, you said syphilis, and it seems like the COVID is overshadowing that, but that's an issue here in Kansas City?
Absolutely. Syphilis, of course, we know monkeypox is national.
Right.
It's also here, of course, in Kansas City. There's been cases recorded, a number of cases for that. And, of course, we're still in an endemic at this point. COVID is here to stay. And so there are outbreaks all the time that we don't hear of as much as we did with COVID. But our public health resourcing is critically important. Missouri and Kansas rank very poorly in terms of the amount that we spend on public health. Missouri ranks 50th and Kansas 49th in terms of per capita spending on public health. That means that we're the least prepared from a state perspective to respond to public health outbreaks and crises. So those are just a couple of examples of things that we should be paying attention to. Our city council is actively looking to fund affordable housing, and they're looking at a bond right now for that. And so we should be paying attention to housing, because we know that one of the ways that people's health is impacted is if you're homeless, if you're transient, if you're moving, that's impacting your health. And we focus on issues that also sit at the nexus of health and wealth. And we know that owning a home is one way to create wealth and also facilitate your health. So those types of things that we're focusing on at Health Forward. And
it filters down into kids with the homelessness. They call it couch surfing, where you go from one relative to another. You might move out of a certain school district into another school district, and that information follows. So how is Health Forward, and how is you as the executive director moving the needle to kind of stabilize some unstable areas?
I'm glad you asked that question, because, some people call it couch surfing. We also hear it referenced as just being transient. Many kids in the Kansas City School District move 5 to 6 times or more in a school year. Obviously, it affects their academic performance and affects their health. When we look at data and we overlay asthma data in Kansas City for kids in the school district, we also see that they're the same group of kids who are in the area of our community that's the most transient, that's moving the most, that's where the homeless population is the highest. And that's a direct correlation between chronic conditions and being housed and being safe. Health Forward has worked on the ordinance called Right to Counsel. That's an ordinance that passed late last year in 2021 that requires the city to pay for legal representation for free for the individual. So if you're facing eviction, you now have a right to free legal counsel, and that is provided to you by the city. Prior to that, many people lost their homes because they did not have legal representation. And we know that 99% of the time, when you have a lawyer representing you when you're facing eviction, you stay housed. You keep your home or you keep your apartment. And so Health Forward funded the campaign for Right to Counsel, which is now a city ordinance. And so we're very happy to be working with the Heartland Center for Jobs and Freedom to implement that, and a host of other individuals or organizations like Legal Aid, training attorneys and making sure that they just don't have legal representation, but those attorneys are culturally responsive, that they understand trauma that's present in many people who have had to face eviction or lose their homes, that they're dealing with many different issues. If you're facing eviction, you got a lot going on. So it's more than just representation, but making sure that representation is prepared to meet that individual and that family where they are. So that's one of the examples of what we're doing on the housing front. We are also working with the city of Kansas City, Missouri on what's called the Office of Race and Reconciliation. So that's a initiative that we partnered with the city on to look at city policies internally and soon externally within the third year of the grant to ensure that we are applying a racial equity lens to public policies and decision making. Many times when we look at policies, we're not asking ourselves who's the most affected, who's the most marginalized, or who would be the most marginalized by this decision. So those are the types of things that we're working on from a systemic perspective.
You're listening to One-on-One with Swope Health. I'm your host, Eric Wesson. My studio guest today is Miss Qiana Thomason, and she is the Executive Director and President of Health Forward KC. Another question that I have for you then, because you talked about the housing situation and how the housing situation, what brought your attention to that?
Well, we are focusing on areas that improve our health and facilitate building wealth, primarily because with the more money you make, the more assets and resources that you have. Studies demonstrate that there's a corresponding improvement in your health. Higher your income, the better your health. The lower your income, the poorer your health. And these are, I'm speaking in generalities, but a lot of data bears this out. So when we thought about the areas of wealth building or asset building opportunities to contribute to, there are several. Of course, there's entrepreneurship. There is, of course, vocational training, employment. There's home ownership and in other ways. And when we thought about what affects health the most and would contribute to wealth building, we landed on housing. It's also an area that is of significant need in Kansas City. There's a very low housing stock in our community. We know that our community, like most urban centers across our country, are still dealing with the vestiges from redlining that took place 50 plus years ago, but are still impacting our community today in terms of generational implications for those policy issues and decisions. And we know that there's been disinvestment, which means resources have been pulled out from communities. And one of the ways that communities can help build wealth and have intergenerational wealth and assets is through home ownership. And so it's an area that we are focusing on both from a policy perspective, like I just spoke of with right to counsel, also looking at this at a state perspective, and how we work with developers, how we work with community-based organizations, with community development financial institutions to help build stock, help get people in homes who are powerful folk but are of low wealth, how to get them access to homes. So we're currently strategizing on our path for working in affordable housing and home ownership creation.
You know, when I was thinking about and listening to you, I thought about, back in the day, grandma would leave their house to mom and them, and then mom and them would leave their house to the kids. But what I'm seeing more and more, and what I've experienced more and more, is that we're not passing on that generational wealth, because I've had relatives that have gotten reverse mortgages on the homes because they've needed money for their medicine and other medical needs. So after they pass, instead of the house coming to the family, it now goes to a mortgage company that loaned them the money. And if you want to buy the house back, like from my personal experience, they said, okay, yeah, you can buy your childhood home back, but you got to buy it back at market value. Mm-hmm. And when they loaned my father the money, they didn't loan him the market value money. So we, in essence, wound up, losing the home that we grew up in. How significant is that? And is that a common problem that we're seeing now? Or is it just kids don't want to pay the taxes on the house and just let it go? But what are some of the issues that are taking place with that?
I think some of the issues are a lack of financial literacy. So when we think about how to prepare people to be homeowners, financial literacy is part of that equation. It should come up so that people know that their house is a tool. It's a financial tool. Mm-hmm. It's a place, of course, for love and belonging and shelter and all of that. But it's also a financial tool where as you pay into it, you can extract money out of it to start a business, to support your kids attending college, to do whatever you need to do with the equity that's in your home. And so we don't find that people have oftentimes that basic knowledge, that financial literacy that should come, that should be coupled with home ownership. And so I think those are one of the ways that I think we can be helpful in terms of making sure that people are prepared. That way, when granddaddy sits down and he's talking to someone about a mortgage, there's somebody in that household that knows, well, if we do this, then here are the risks, here are the benefits, here are the rewards, and this is what we never dig ourselves out of based on if we made this decision. So I think financial literacy is I think, the most important thing to do. And then making sure that as a community, that we ensure that that community is being built up enough so that resources are there. You just can't plot houses, right? You want to make sure that there's resources there, there's services, there's jobs, and all those different types of things so that people can thrive and be close to the resources and the conditions that they need to be well.
Okay, and you bring up one great point, and I want to kind of wrap up and close with this: affordable housing. And for some reason, when we think in a mindset of affordable housing, we think of low-income housing. But it's not where we should have low-income housing only. We should have mixed, because you need that middle income, you need that upper income, because they need to go to the grocery store so that you have quality grocery stores. They need to come in and pay taxes so that you have a tax base. So explain affordable housing and how it should be encompassed with middle income and upper income housing?
Well, first, let me say I'm not an affordable housing expert. Let me first say that. I am a layman in this space, and so I can explain it from my layman's perspective. But to your point, when you concentrate poverty, that really just creates additional poverty.
Mm-hmm.
And so all of the neighborhoods, many of the neighborhoods that we've seen thrive and be successful from work like the community builders of Kansas City and investments that they're making in housing, we see a mixed income where there are people who have lower than the average median income, or AMI, that's what that stands for, and people than the higher average median income. And so you want people who are at, below, and above to be in a community. Typically, when you see that, you see not just diverse incomes, but you see diversity of ethnicities, diversity of thought, diversity of resources being poured into a community, and different access to means. And so that's the biggest thing of when you talk about low income, is making sure that there are different levels of accessibility through paying attention to that average median income. The people that I will refer folks to get some more expertise on that are organizations like LISC, LISC, and Urban Neighborhood Initiative, or UNI, and those types of organizations that you can look up and get additional information on that. Health Forward is investing in it from a policy standpoint, as well as from a using our assets, our grant making, and our assets that are invested and through our corpus, to be able to seed and work with governmental partners, work with developers to help close the gaps to create more housing.
Qiana, I could talk to you for an hour, 2 hours. I appreciate you taking time. Very busy lady. And I'm just glad that she was able to squeeze us in to give us some insight on connecting health, not only eating healthy and exercising, but to other avenues that create health issues. So thank you so much for joining us.
Thank you so much for having me. If you'd like to learn more about Health Forward Foundation, go to healthforward.org.
Who can they call?
They can call any of our staff people.
Okay.
If you go to healthforward.org, you'll see our staff listing, and you can see who you would like to reach out to based on the need that you have.
All right. Thanks so much for joining us. Have a fantastic day. And remember this, I have the greatest listening audience in the world. Till next week, remember, tough times don't last, tough people do. Until next week, peace.